Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
Jennifer Masika from Bwensumbu Sub-County travels more than 20 kilometers in order to access health services at Resande Health Center 4 in Kasese district. She is expecting a baby and says it is in her interest to have good maternity services to avoid pregnancy complications.
We have no hospitals that offer maternity services in our area. I also have a problem of transport from my home to reach the health facility. I normally sell some of my property like food to get transport.
Masika is one of the many who make the sacrifice to forego Bwensumbu Health Center 2, which is within their proximity for Resande Health Center 4. This is now affecting the efficiency of the facility.
The number of clients outcompute the space, and you find clients really automatically on the floor.
According to the Health Ministry's data on human resources for health information systems, the facility has up to 93% of the required staff. But they still lack some equipment to handle the surging numbers of patients.
We have a theatre which operates, we have a scan, but we have a problem of X-ray. Recently, as only an ambulance, it is a challenge that we would also need to have a positive impact in order to transport most of the clients, more especially to effect referrals.
The facility received 65 million shillings through result-based financing to uplift standards and services, but this is not possible.
We cannot be able to equip the facility at that level being a health center 4. So we request the government to put it into consideration and give it another status to a level of a hospital.
But of course, with that money, there is staff incentive, there is money for quality improvement. So it doesn't only focus purposely on maternal and child.
The acting senior nursing officer here advises that elevating health center 2s that surround them could help fix the challenge of crowding.
And they actually deploy or recruit health workers to those facilities so that they actually take a service nearer maybe to the people in the community. It would help them. And if they would also recruit more midwives, because currently here we have around 4 midwives who are recruited by government. Others are paid by this RBF money, so it is a challenge.
Because this is where all the challenges originate. For example, Isule Health Center 3 handles up to 200 women in their antenatal and more than 35 mothers in maternity every month. The health workers here say the facility can't handle such numbers.
More buildings, either more wards, where we can keep them, the waiting mothers, because nowadays we just put them in the postnatal wards, where it is not possible to be mixed with those mothers who have just delivered.
The health workers have now resorted to asking expectant mothers who stay far away to camp at the health center.
Because labor pains will begin at night and nobody will help you down hills to the facility.
We have only one stretcher in the facility, so they first come and pick the stretcher to go and carry a mother. From there they take it to the mother. After then that's when they bring the mother. So most of them, when they come and pick the stretcher, they find when the mothers have delivered on the way.
First of all, the terrain you saw, they are totally hills and it's ever raining. So the best is you come and camp.
This is the only center we have. I don't think this will accommodate their relatives. So they have nowhere to stay, as in when they are waiting for delivery.
And once you deliver out of the health center, you are still required to remain at the facility for at least 4 days.
Because we never know the circumstances and the conditions under which they delivered could have been some infection and to bring problems to both the mother and the baby.
The health center receives primary health care funding of 2 million shillings per quarter, which is insufficient, rendering it to rely on external financing.
It is not enough, because if they were giving enough, we would be now able to buy extra mama kits. We also maybe buy gloves. Baila Uganda is one other group that is helping us, that one other NGO implementing partner in the district, Save the Children. For them, they give us equipment.
Ministry of Health says the upgrade of health centers from 2s to 3s will solve many of these challenges.
This is going to come with with an increased funding. It's already about 124 almost complete, and we are in the process of ensuring they have what it takes to give adequate health services to the people.
Out of 19 approved positions, Isule Health Center 3 has only 8 filled, without a senior medical officer among the vacant positions. This puts the facility at 42% staffing. Walter Mwesije, NTV.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.